Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Fluid in the ear and its causes. Fluid in the ear often occurs with an ear infection, especially in kids. The inflammation or congestion that blocks the eustachian tube, a small drainage passageway in your ear, can also be due to allergies or the common cold. Eardrum injuries, nasal polyps, or even teething in babies can cause fluid to build up in the ear. /r/n/r/n The blockage traps fluid in the middle ear in the space behind the eardrum, leading to symptoms like muffled hearing and pressure or pain in the ear. Treatment options vary but can include antibiotics. Some people may need to have tubes placed in the ears or surgery to remove their adenoids. /r/n/r/n Illustration by Emily Roberts for Verywell Health. /r/n/r/n Symptoms of fluid in the ear can be mild or severe. Possible symptoms include /r/n/r/n Some people may experience ringing in the ears, tinnitus, or have balance problems due to dizziness or vertigo, the feeling like everything around you is spinning. /r/n/r/n In children, fluid in the ears is common. About 75% of children will get fluid in their ears at some point before age 3. Additional signs of fluid in the ears of children can include /r/n/r/n Fluid in the ear may not be suspected until a small child exhibits issues like speech delay or difficulty with a hearing exam. /r/n/r/n Fluid in the ear is sometimes called otitis media with effusion, OME. Fluid due to OME is not infected, but middle ear infections occur when ear fluid has been infiltrated by pathogens like bacteria or a virus. /r/n/r/n Common causes of fluid in the ear include /r/n/r/n Anyone can get fluid in their ears, including adults treated with radiation for head and neck cancer. However, children have smaller auditory tubes that are more horizontal than in adults, which can encourage fluid to pool in the ear. /r/n/r/n White, yellow, or brown earwax is normal, but it should only be a small amount. If ear discharge continues or has blood or pus in it, seek emergency care. It may be the sign of a ruptured eardrum. /r/n/r/n Fluid in the ear often goes undiagnosed because it may not cause any symptoms. To identify the cause, an ear, nose, and throat specialist, otolaryngologist, may have better training and diagnostic equipment than your pediatrician or other healthcare provider. Tests include /r/n/r/n Keep in mind that neither exam can diagnose hearing loss, but they can point to the need for additional tests. /r/n/r/n Fluid in the ear usually drains on its own within a few weeks, but other treatments may be needed depending on the cause. Children who are at a higher risk of complications from fluid in the ears, including those with developmental delays, may need earlier treatment. /r/n/r/n Possible treatments can include /r/n/r/n Antihistamines may help keep allergy symptoms and chronic sinusitis from clogging your ears, but they will not necessarily rid your ears of fluid that's already there. /r/n/r/n For adults, it can take up to 3 months for fluid in your ear to go away on its own. If you continue to have problems, your provider may consider additional causes or treatments. /r/n/r/ No benefits have ever been shown for special diets, herbal remedies or special diets, chiropractic care, or other complementary or alternative medicine therapies. Research on the safety and effectiveness of these treatments for otitis media with effusion is limited. /r/n/r/n These steps may help to prevent fluid from collecting in the ear. /r/n/r/n Staying up to date on vaccines may help. The pneumococcal vaccine, Prevnar, helps prevent the most common type of ear infection. Getting a yearly flu shot prevents illness that can lead to fluid in the ear. /r/n/r/n Fluid in the ear, Otitis media with effusion is a common condition, especially in kids, that does not always need to be treated. It can be caused by inflammation, mucus, or a structural problem in the ear that blocks the fluid drainage from your auditory tube. /r/n/r/n If you have symptoms, they may include pain, muffled hearing, or a feeling of fullness in your ear. Fluid in the ear may gradually go away on its own, but other treatments might be needed. They include antibiotics if there is an infection, or surgery to help drain it if the fluid buildup does not get better or gets worse. /r/n/r/n Simple strategies may help prevent fluid buildup, such as avoiding irritants and allergens, washing your hands regularly, and staying up to date on vaccines. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.